and thank you so much for tuning in at Tendri Embu Children's Hospital. We are coming back like we never left. This is Talk to Your Doctor Show. I'm your host, Washera. So today we are talking about orthopedic. Yes, you have a problem with your bone, you have a fracture. Now today we're going to talk about all this, about fracture management. And today we have our orthopedics trauma technician who will be introducing himself right away so that he can talk to us about fracture management. So karibu sana to the show. You can introduce yourself to the viewers and then we continue with the show.
Oh, thank you so much. Thank you so much. Good evening, everyone. For those who are watching us from every corner of Kenya, welcome to this show. My name is Marani Franklin, orthopedics and trauma technician, based at Tendri Group of Hospital at Majimbo.
Yeah.
Karibu.
Okay. Today we'll be talking about the principles and about orthopedic and what you are doing. So I can ask a quick one. What made you do orthopedics? What made you not go for clinical, maybe nursing or something else?
Orthopedics and trauma, let me say generally, is a nice course and is a nice medical specialty. To the rising cases of road traffic accidents,
Yeah.
this made me to pursue this course,
Yeah.
and I love it so much. Seeing people waking up again, restoring back their functional position of the broken bones,
Yeah.
it makes me go.
Yeah.
Fine. Thank you.
Okay. So if someone has a broken bone, it can be repaired and it can be okay. People can walk again after they have broken their legs. They can use their hands again after they are broken. So we go to how many bones does a human being have?
Oh, thank you. A normal human being has 206 bones.
206.
206 bones. That is okay. From an image here, from the skull to the toes, those are bones. And bones makes the framework of our bodies. You can imagine the muscles, the skeletal muscles, the skeletal with the muscles without the skeleton.
Yeah.
So the bones make the framework of the body.
Yeah.
Good.
Oh, nice one. So we have 206 bones, and someone is somewhere breaking someone's heart. They can break one bone and you repair it.
Yeah.
Okay. So let's go. What is a bone?
Okay. A bone, or let's say bones. Bones are made of connective tissues, reinforced with calcium and a bone cells.
Yeah.
And when I talk of bones, as I said earlier, bones are the framework of the body, and each bone can break. Each bone can break from the skull. That's why we are here to correct that.
So the bones in your skull can break.
Yes.
Have you experienced a client who has broken the bone in the skull?
Yes, so many of them.
So what is the main reason that causes that? Or did they fall down, or what happened to them?
Okay, the main causes of bone fractures mainly are trauma cases.
Yeah.
You may have a fall, road traffic accidents. There are also pathological fractures, causes of fractures, and so on.
Okay. So we talk about a fracture. Now, what is a fracture?
Okay. Talking of fractures, fracture is breakage to these bones,
Yeah.
to all these bones you are seeing here.
Yeah.
A break to any bone, or a discontinuity to the bone.
Yeah.
But before that, you know, our bones are covered with the muscles,
Yeah, the muscles.
the soft tissues, inclusive of the muscles.
Yeah.
So before a fracture happens to a bone, there is an injury to the soft tissues. That is the muscles,
Yeah.
the blood vessels, the nerves, the tendons and the ligament. That is if they happen to a joint.
Yeah.
So before a fracture happens, there are injuries to the soft tissues. That's why we say immediately after an injury, if immediately after an injury, some people have been using hot or warm water to manage injuries.
Yes, yes.
But I'm here to tell you that you better use cold water, because when using hot water or warm water, you are injuring the blood vessels, because immediately after an injury, the bone immediately after injury, there's the high supply of blood around that area. So when you use warm water, you are causing that place to swell. There will be more edema, there will be more swelling, and more tenderness. So please, let's use cold water or ice packs. Thank you.
And I've seen people even at home, when they break, leta maji moto na weke chumvi.
Yeah.
So that's what people do. So people should be using cold water.
Cold water is the best because it will cool the temperature, and then because of the expansion of the blood vessels, when you use cold water, you will constrict the blood vessels, so that there will be no pain after that. Thank you.
Okay, so we go to the principle. You told me you do one principle, so you can talk about the principle. Okay,
today, as I told you earlier, we are talking over general principles of fracture management.
Yeah, sure.
And principle number one is first aid. First aid, and I want to say this. Fracture management starts immediately after an injury. That is from the scene of an accident. And I'll be using an example of a road traffic accident.
Yeah.
First aid happens immediately at the scene of an accident. And if you are a skilled medical practitioner and an accident happens, first aid, number one, I will be using the danger Dr. ABC. Dr. ABC, D stands for danger. So this medical practitioner will be looking for the danger zones. If this accident happens along the electricity wires, or this vehicle was okay, let's say petroleum transporters.
Yeah.
You need to look at the danger zones. To avoid that, you need to take this victim out of danger.
Yeah.
And then the R, now the doctor, the R now, you're looking for the response of the patient, of this victim. The response, is this client, is this victim responding? And then we are going to A, the A, Dr. ABC, A, the airways.
Yeah.
You look for the airways of this patient.
Yeah.
If there any blockage in the nose, the mouth, the ears, you need to remove all these so that we get the good flow of air. And then we're having the breathing. The breathing, you'll check the movement of the chest, and then the circulation. Now the respiratory.
Yeah. Now this one is done when the fracture has happened to any part of the body.
That happens immediately after an injury.
Any injury.
Any injury.
Even if it is
but I said I'll be using an example for a road traffic accidents, because these are commonly fractures. The cause of fractures we are getting into our facilities in Kenya.
Okay. So what is the aim of this first aid?
Good. The aim of first aid, everyone knows. And aim number one is we are promoting and saving life. And then the other aim is we are preventing more injuries to this victim by doing the first aid. And then another aim for first aid is that we are promoting the healing.
Okay.
Yeah.
So everyone can do first aid. They don't have to wait to bring the patient to the hospital. Once they evacuate the patient, they should be doing it before they bring the patient.
Yeah, first aid is important.
Yes.
That's why we outlined the aims of first aid. So immediately after you've done the first aid, take your patient to the hospital.
Okay. So how long does a fracture takes to heal?
A fracture, I can't say exactly that, how long does a fracture takes to heal.
Yeah.
But fractures healing depends with age, one, the degree of injury, the displacement of the fracture,
Yeah.
and I've talked of age.
Yeah.
Yeah. But before that, there is principle number 2. Principle number 2 is reduction.
Yeah.
Now this client now has been referred or has been taken to the hospital where we are now. We need to reduce the fracture. By reducing the fracture, we are using a method called traction, counter traction, where we take the bone back to its anatomical position by the use of the manual manipulation. In other cases, we may even sedate the patient to reduce the fracture. So under reduction, there is something called diagnostic investigations. Before we do any reduction to a fracture, we need to do a diagnostic investigation where we take an X-ray. In other cases, we can do a CT scan, an MRI. Where at 10 we have all those diagnostic images, investigations, the MRI, the CT scan, and the X-ray. So for the first line, we are doing the X-ray to ascertain the fracture. Is this a really fracture? How deep is the fracture? How is the displacement of this fracture? So that we can do the reduction.
Yeah.
Whether this dislocation, there are fracture dislocation that happens within a joint. Yeah.
I've seen patients who have come to the hospital saying, I have a fracture. And when you have an X-ray, actually it's not even a fracture, it's the muscles which have been...
Thank you. From my definition, I was defining a fracture as a discontinuity of a bone, or a discontinuity of a bone to the bone cortex. The bone cortex is the outermost part of the bone. The bone is divided into 2 parts, the periosteum and the endosteum. Now the periosteum, on the outer side of the periosteum is the cortex. Sometimes we miss this from the X-ray, but as an orthopedic, these people have an orthopedic eye. They can note a fracture to the cortex, the cortex of this bone, where other medical professionals may miss. That's why we are having orthopedic specialists. Thank you.
Oh, nice. And so we go to the next principle.
Okay, principle number 3 is immobilization. After we've done the diagnostic investigations, we've reduced the fracture, we need to immobilize this fracture. By immobilization means we are going to use the plaster of Paris. So many people know of plaster, the white thing people used to see. Yeah. There's a plaster of Paris. We're having Gypsona and the Dynacast, the new one. And we're also having splints. We also use crepe bandages to immobilize that. Yeah. We also have Domas splints for lower extremities. We also have malleable splints for upper extremities. And lastly, we have ORIF, open reduction and internal fixation, where we use the plates, the nails. Mtu unasikia anasema amekiwa chuma. That's a surgical procedure now to immobilize these fractures.
You can maybe explain to us which client is likely to have an olive.
Good. In short, in other words, we are saying indications for surgical procedures.
Yeah.
For elder patients with fracture femur, fracture femur, we are having an image here. This is a fracture femur.
Yeah.
For patients above 5 years, five or okay, let's say 10 years and above. For fracture femur, we will do an ORIF, the open reduction and internal fixation, because this is a single bone. You're seeing here, this is a single bone that when managed poorly will lead to a deformity. Where after deformity, this patient cannot walk because of the deformity. You'll see this patient moving like this with a limping position. So we also have a humerus bone. We also have the skull, the ribs, but it depends with the degree of injury. Not all femur fractures, not all humerus fractures, not all skull fractures or tibiofibular fractures are managed with ORIF. Not all of them. It depends with the degree of injury, the displacement of these fractures. That's why I said there are fractures that happen to the cortical of the bone. Those are managed with splints. When I talk over splints, for those clients who have visited us before, unasikia daktari anasema utakiwa plaster nusu, that is a splint. Plaster nusu, that is a splint. And we also have tarsal bones. We also have the pelvic. For pelvic also we can do ORIF, but it depends with the displacement of the fracture.
I ask a question for someone who is watching.
Yes.
Mtu amewekwa chuma kwa mwili. They won't be feeling the chuma after maybe in a...
Okay, the chuma, that's good. Okay, the implants have also, they also have their side effects, but it depends with the condition of this patient. It depends with the condition of this patient. But most of the cases, they don't have that much side effects because after some years they are removed. These implants are removed.
Oh, they're removed.
Yeah, you don't stay with them forever. These implants are removed.
Now the procedure of having it being done, having it being removed, another hood again. How do you advise people? Like, let's say it's time to be removed. Now the client will have another hood. What happens?
Okay.
Or how can you advise patients to have the ones to stay with forever or the removable ones?
Okay, as I said, fracture heals, but with age, these implants are removable. So after application of these implants, when you come for these checkups, these reviews, and you see that this fracture has healed completely, we can remove these implants and you go back to your normal functional position without any other complications. Yeah.
So you can walk comfortably again
after the removal. Yes.
Do your things comfortably.
Yes.
Oh, that is nice. And all these things we are doing them here at Tendre, and we have an orthopedic surgeon who comes every Thursday and Saturday, so you can visit if you have such a client who has maybe something needs an olive, maybe needs to be done, the bones are broken, you can bring them here at Tendre. So we were at principle number 3. Were we done?
No, I think we were finishing that. Huh?
Yeah.
We were at the ORIF. So after we've done the diagnostic investigations and then you've seen you are a benefit, you will benefit, our patient will benefit with ORIF. We'll admit you after 2 days. We do the ORIF and then we release you back home. But after that, you'll be coming for the checkups to ascertain how you're doing. Is this fracture healing? So principle number 4 is now the preservation of blood supply. And under this principle, we are preserving the blood supply to the whole body. After the injury, we've immobilized this gland. We've bedridden this gland. This gland will be asked to elevate the limb. You will be provided with drugs, anticoagulants, antibiotics to cater for the infection. analgesics to cater for the pain, and then calcium supplement to strengthen those bones. And then we also have a nutritionist around. He will be guiding you on the use on the good diet, so that we promote the healing faster.
Yeah.
So that is all about preservation of our blood supply. And then the last principle is principle number 5. That is rehabilitation.
Yeah.
After healing, or after removal of the implants, of the plaster, of the splints, we'll be asking you now to move. Now you'll be asking the client, kanyaga kidogo, and now we'll be using the walking frames, the crutches, to move. By restoring the function, we are taking you back to your normal functional position of these limbs before you are injured.
Okay, so taking a client to the normal functions, how long is it taking for this client to get into this stage?
Okay, it depends with the response of this client. Daktari akisema haya leo tukuje tukanyage, follow these instructions carefully.
Yep.
And I want to say this. During immobilization, this client has a plaster of Paris, a POP. There are some clients as a POP, but because the doctor said this thing should come back when it's clean, the client goes back anaifunika vizuri, and then but he's using that limb. Unapata the client analima nayo, he's using this limb to dig, so that it's the okay, he has closed that cast very well, but he's using this limb to dig.
Yeah.
This fracture will not heal. By immobilization means we are okay. Let me use this. These are bone. These are broken bone.
Yeah.
2 pieces now. When we are immobilizing the fracture, we are taking these bones into the anatomical position to avoid movement. But if you continue to move, if you bear weight to this fracture, you are destroying this fracture. It will not heal.
It will not heal.
You'll stay with this cast forever.
Forever.
You'll stay with this implant forever. It will not heal. Thank you.
So people should be following doctor's instructions.
People should follow instructions. When doctor say avoid water spillage to this cast, avoid this total non-weight bearing. Don't bear weight to this fractured limb.
Okay.
Don't and then there's the do's. You elevate the limb to allow the free circulation of blood, and then you flex the limb to encourage that, and so on. And remember, after the management, we do ask our patient, if you feel you're not comfortable, if you feel like, this thing is not good, report to the facility immediately. Report the facility immediately, so that we can ascertain what's going on. Yeah.
So let's say someone followed the instructions, and they had the olive, or they were put the POP. How long does it take to heal when the patient takes instructions that you've given them?
As I said, immediately after an injury, fracture healing starts immediately. Even if you are injured and you are never attended, but the fracture fragments are intact, they will heal in that deformity. That's why that's when you see a client coming to the facility with a deformed hand, with a deformed leg. But what I want to say is fracture healings depends on the age, depends on the fracture displacement. But immediate after 3 weeks, the fracture is healing. It's healing. Yeah.
So the younger you are, the quicker the healing.
Good. Yeah.
Oh, nice one. So all people should take care of their bones not to break, like us.
Okay. Like let me say this. How can we avoid fractures?
Not wearing heels.
Okay, for those who have well-furnished houses, let's use a very nice tiles. Let's with not a slippery tiles. Slippery tiles may break your bone. Let's not overspeed. Let's not overtake in bridges, in sharp corners, to avoid accidents. Let's avoid walking at night without lights. You may fall into a ditch and then you break your bone.
So people like
let's avoid slippery surfaces. That's why when we walk around our facility, you'll see slippery floors. So this is an indication that this is a slippery floor. You need to walk carefully to avoid those injuries.
And some of us who wear heels, we want to...
With my good ladies, heels. Yes, we have cases. We have cases of fractures because of the high heel.
Yeah.
Our good ladies. Let's avoid high heels.
So they avoid the high heels.
Yeah.
So I think there's someone asking here, we are almost done. We've done with the 5 principles
Yes,
of taking care of our bones. So why is diagnosis, investigation so important in treatment of bones? Why is it very much important?
Thank you. That's a nice question. In rural areas where we don't have these x-rays, we've been having challenges whereby a client comes, we ask them to do an x-ray. They say we don't have enough funds. But remember, when doing an x-ray, before we do any cast, before we do any procedure to an injury, an x-ray is very important. Why? We ascertain the degree of injury, the displacement of this fracture, how this fracture is displaced. Let's use femur bone because this femur bone is more visible. A displacement of this fracture femur. When we mobilize this fracture, or when we treat this fracture without any x-ray, will not meet the target, or we won't take it back to the normal anatomical position, because this is a single bone. It's not like tibio-fibular bones where there are two, they're supporting each other. The moment there's a fracture femur, this patient cannot move. But with fracture tibia, some patient can move, they can limp. But with femur, my friend, you cannot move. So diagnostic images, x-rays are very important in such cases before any management.
So what happens to a client who comes, daktari unaona mguu imevunjika, achana na mambo ya picha. There are such clients.
Yeah.
So what do you do?
First, we need to do an x-ray. We
Like
can't.
you know, the patient has their rights also. They can say staki picture.
Okay, fine. But we cannot do that. But for such cases where they come, they have been treated somewhere without an x-ray. Obviously, there's a deformity. This patient will end up. They will end up with a deformed hand, deformed lower limb because of a poor reduction. Because you can't reduce a fracture without knowing what are you reducing. You are not reducing what you don't know what you're reducing. So with an x-ray, it gives us exactly. This is a femur fracture. This is a femur fracture. This is a fracture now. This displacement. How do you know that this fracture is displaced laterally?
Yeah.
So with an x-ray, it will show that. So that we take it back to their anatomical position.
Okay. Oh, nice one. So I think people are getting enlightened on this, and I'm checking people's feedback, and they are watching in big numbers. And there's some on my lab say following my twin bro. Someone is watching.
Thank you.
Modi is saying following live. Another one saying Niko live kwa nyumba. We are live. Nice one, doc, with Susan Jerry. And people are watching, and I'm sure they'll be asking so many questions, and I'll be directing these questions to you as they are coming to our social media pages. So being an orthopedic technician, what would you tell people who have broken bones, or their families or friends whom they know they have broken bones but maybe they are ignoring? Kuna wale wanagongwa nyumbani wanasema ayumi sana, achane nayo. So what would you tell them? people.
Thank you. Before I answer that, let me say this. There are also those patients that they were treated somewhere without an X-ray, without any medical investigation. They were just treated kienyeji. You've heard of daktari wa kienyeji, mitishamba. So with such cases, they end up with a deformed limb. Napata client ako na mguu fupi, mkono fupi ama ndefu. Loss of function with fracture humerus. With the fracture humerus of the elder, this limb cannot move. The moment you've broken this, the fracture humerus, these are humerus bone, and was poorly managed, it won't come back to its functional position. So immediately after an injury, take your client to the hospital, the nearest facility, and make sure you do an X-ray to ascertain the degree of an injury before any treatment is administered.
Of course, there are people who have already done that.
Yeah,
they have
true.
maybe been treated without the X-ray, and maybe the hand became deformed. Is there a way you, as an orthopedic, you can make that bring it back to
Very
normal
well,
again?
very well. That's why we are here at Chenry. We welcome you all. In such cases, just come the way you are. We will manage you. We will manage you, and I will be there to give you the best.
Yeah.
Because we treat, but God heals.
Yeah, sure.
We welcome you all. Karibu sana. We will give you the best as we can.
Nice one. So there's a question I had asked of someone who is watching. They have a fracture. They could be going through some trauma in their lives. What would you advise them today?
For those patients who visited us before, I believe that we've managed you well. And for those maybe they never followed the instruction, welcome you back. Just come back.
Yeah.
We are there for you.
Yeah.
We are there for you 24/7 from Monday to Sunday. At nights we are there 24/7. We are there to give you the best.
Okay, next one. So thank you for coming through for the show. We
Yes.
are done with 30 minutes. I think it was a very good discussion.
Thank
and
you.
I'm sure so many people are watching. So even those people who have back problems, not only the legs and the hands, the back, if they have problems.
Any
the
bone
The
deformity, any bone injury,
Yes.
any bone disease, any pain to the bone, to your bone, just come to Chenry Group of Hospital.
Wow.
We'll give you the best.
Nice one. And I understand the bone has 206. So if one is broken, just come here and we'll be able to
restore that.
Yes, to restore that. And our orthopedic technician, you can see them from Monday to Sunday every day for 24 hours. You can find our orthopedic technician. So you can come during the day, at night, and our orthopedic surgeon comes here every Thursday and Saturday. So make a point of visiting us. Come see us and we'll be able to restore the broken bones. Dr. Thank you so much for coming through for the show. I'm sure you need to go see clients, and thank you so much for restoring people's bones. I'm sure people are happy there for the services that you offer, and for all other services that you need, we provide them here at Chenry Hospital, starting with outpatient, inpatient, any consultation that you have about your health. We are here to provide them for you. We are grateful for you watching Talk to Your Doctor show. I have been Washera. You can continue with this conversation on our social media pages by watching through Embu newspaper or Chenry Embu Children Hospital, or you can talk to us on 0723 386 706, also 718 918 189. You can call those numbers for any consultation that you have for 24 hours. We are grateful for watching this show, and we say your health is your wealth. Thank you so much for tuning in. Until next time.